The Nigeria Center for Disease Control and Prevention (NCDC) has revealed that the country has recorded a total of 8,569 suspected Lassa fever cases this year, resulting in 1,035 confirmed infections and 174 fatalities across 28 states and 129 local government areas. This hike in case detection prompted the NCDC to urge health commissioners across the 36 states and FCT to develop localized response systems to better manage outbreaks. In a press briefing held on November 12, 2024 in Abuja, the Director General of NCDC, Dr. Jide Idris, said the compelling data shows a dire need for resource mobilization and infrastructure enhancement to contain these public health threats. He highlighted that without a robust state-level response, it would be challenging to mitigate the impact of outbreaks, especially in crowded urban areas.
Lassa fever is an acute viral hemorrhagic fever. When we say hemorrhagic, part of the symptoms is that when they cough or they sneeze or they lose blood. That's why it's hemorrhagic, and it's caused by the Lassa virus. The natural reservoir of the virus is a rat, what we describe as multi-mammate rat, also known as African rat. But other rodents can also act as carriers of this virus. We have continued to see a steady rise increase in the number of cases, states reporting Lassa fever cases, that's this year. And the rise is due in part to improved surveillance, better community awareness, environmental degradation from climate change, and other harmful human activities.
Speaking further on the cerebrospinal meningitis (CSM), the NCDC boss said it poses significant threats as the dry season looms. According to him, between 2023 and 2024, the country reported 4,950 suspected CSM cases, with 380 confirmed and 361 deaths in 24 states. Dr. Jide stressed the urgency of vaccinations and early interventions to prevent further fatalities.
Now, despite significant progress in surveillance, diagnostic capabilities, and vaccination over the last few years, CSM remains a priority disease and ever-present public health threat in Nigeria, with annual outbreaks in high-burden states that present a challenge for people, our health systems, the economy, and the communities. While we continue to intensify efforts in an all-of-society approach, the public is hereby advised to know that the virus spreads through 1. Direct person-to-person contact, including droplets from the nose and throat of infected persons. Meningitis affects all ages. The most at-risk persons are young children, especially those under or not immunized at all. Those of them who have not either been vaccinated against meningitis or they've not gotten the full correct doses. For you to mount properly an emergency response, you must have those capabilities or capacities essential for you. And there are very many. You must have your infrastructure in place. You must have your human resource people or the personnel you want to use in place. You must have the materials used in place. You must be able to collect data when this is occurring. How do you rapidly collect data? That's where surveillance comes in. You must be able to detect cases and manage these cases. So there are so many things again. So many of them have infrastructure in place, like treatment centers, isolation centers. Some of them had labs. I recommend those that are already completed, we will complete. For those that have been completed, they don't have staff, we support them in training how to do stuff. These are what they call preparedness. So if you know if meningitis occurs, what do you need? X, Y, Z to treat, to diagnose, or to go out to collect that. You look at those materials, you start stockpiling those materials now.
Added that the NCDC, in its effort to ensure early response, has reactivated partnership with the National Orientation Agency to boost public education on preventive measures. Communities are urged to maintain cleanliness, reduce rodent infestation, and ensure proper food storage. They urge immediate medical attention if symptoms such as fever or headache appears and to contact the NCDC toll-free line at 6232 for rapid assistance. Vincent Okushi, QTV News, Nigeria.